Senator Warnock.
Well, thank you so much, Senator Stabenow, and thank you for your leadership on so many issues. I'm grateful to Chairman Wyden and Ranking Member Crapo for having me here today to talk about health coverage, an issue that is near and dear to my heart. In my home state of Georgia, there are 275,000 Georgians in the coverage gap. This is an equity issue, 47% of whom are Black, 9% are Latino, 63% are working families. There's still 500,000 Georgians who are uninsured, 646,000 Georgians who would qualify for free and affordable health coverage if Georgia joined the 38 other states and the District of Columbia in expanding Medicaid. So our mission today, for me, is very clear. Today we have the opportunity to uphold the promise we made 11 years ago when we passed the Affordable Care Act and provide quality, affordable, and comprehensive health coverage to 4.4 million Americans. And every day that we delay is another day that the least among us continue to suffer. As we debate whether and how to expand health care coverage here in the state, lives are literally caught in the crosshairs. We need to remember the faces of those who are affected by the policies we choose to create and not create, the human costs of the policy work we do here in the Senate. There are real consequences for real people when we fail to do what we were sent here to do. So today I just want to recount a story that I told on the Senate floor not long ago, and I want to lift up the life of a Georgian who fought to expand Medicaid as she and other Georgians lived in the coverage gap. Every time I talk about this issue, I think about Lori Davis of Covington, Georgia. She was one of our heroes, and she spent much of her life serving her neighbors. She was a trauma nurse at the Grady Memorial Hospital, a hospital not far from my home and my church. I've seen the incredible work they do there every day. Well, while working as a healthcare professional in Atlanta at Grady Hospital, Lori was diagnosed with pelvic adhesive disease. The chronic pain associated with this condition eventually pushed her to leave the nursing profession. And after that, while also working to manage her own chronic condition, she struggled to maintain steady employment in restaurants. During this time, Lori could not afford health insurance. She made too much to qualify for Medicaid, but not enough to qualify for subsidies and afford other insurance plans. I'm hearing a lot of talk about choice. Choice is an illusion if you don't have the resources. This left Lori unable to purchase health insurance because it was financially out of reach. She lived in the health care coverage gap. And she went without coverage for years, relying on her own medical training and free health care clinics to treat her chronic condition. And then in August 2020, Lori began feeling ill. Her condition got worse, and fearful of costs, she delayed seeking health care coverage. Think about that. Lori, who spent her life treating her neighbors in the Grady Memorial Hospital, living in the wealthiest nation on the planet, delayed seeking health care coverage because she couldn't afford it. It seems to me that as members of this body, we should be ashamed that in the richest nation in the world, in a country with some of the best health care coverage in the world, some citizens would choose not to seek treatment because they fear they can't afford it. The price tag of life-saving care. And so the next month, in September 2020, Lori was admitted to the hospital with pneumonia. And while there, she learned she had lung cancer, a treatable condition, had she received an earlier diagnosis. Put together, it was too much. And on September 17, 2020, Lori passed away after her short battle with pneumonia. Lori's story would have been different, could have had a different ending if she lived in Oregon, if she lived in Idaho, or most of the other states represented here. Can you imagine Medicare in 38 states? Can you imagine Social Security in 38 states, conventional Medicaid in 38 states? We can't imagine it because it's the law of the land. Well, 11 years later, the Affordable Care Act is the law of the land. This is not about rewarding states for bad behavior. This is not about your state or my state, a red state or a blue state. This is about a very basic principle. In the United States of America, access to quality, affordable health care should not depend on where you live, and we should not allow state politicians to undermine that basic principle. Americans are literally dying for lack of health care coverage. And so let me be clear as I wrap up. I'm a little bit over time. Forgive me, I'm a Baptist preacher. I'm not asking for additional benefits for Georgia or better coverage for those in Georgia or those in the 11 other non-expansion states. I am asking for basic fairness and equity. I'm asking especially that we give the working poor, because largely that's who we're talking about in the coverage gap, give the working poor a chance. I'm asking that every American everywhere in every state and every zip code have the same opportunity and the same right to live. Dr. King said that of all the injustices, inequality in health care is the most shocking and the most inhumane. I believe that health care is a human right, and in America, it ought to look that way in every single state. Thank you so much.